our hospitals have been attacked, our ambulances have been hit. So, nowhere is safe in Gaza. And unfortunately, one of our staff lost their 5-year-old daughter.
What is your incentive to take up this kind of a job?
Let me narrate an incident.
ഈ മഹാരാജ്യത്തിലെ ഒരു ചെറിയ വിഭാഗം ജനങ്ങൾ മാത്രം സംസാരിക്കുന്നതാണ് എൻ്റെ ഭാഷ. പക്ഷേ ഞങ്ങളുടെ ഭാഷ സജീവമാണ്, ചലനാത്മകമാണ്.
Can you tell us about the humanitarian tool of Gaza through some of your anecdotes?
We are a medical humanitarian organization, which is one of the largest in the world. 51 or 52 years old organization, work through different wars around the world and conflicts. So a conflict would not be a new thing for us. But what our teams on the ground, we do have our teams on the ground, and we have been in occupied Palestinian territory for since 1989. So our presence on the ground has been historically there for many, many years. So we have a team on the ground which comprises of our Palestinian colleagues, but also comprises of people coming in from different parts of the world. Because we have doctors, surgeons, anesthesiologists, they come from different parts of the world, including India. So from a care point of view, humanity is the thing that binds us. So what is that is happening on the ground is like, to start with, nowhere is safe. Let me narrate something that has happened as recent as yesterday. Because of the evacuation orders, most of the population in Gaza has moved towards the south. For the sake of, the viewers to understand what I'm talking about, Gaza is from one part to the other part of Gaza. We're just talking about 25 square kilometers. It's a drive of an hour that you would go from north to south. And we are talking about 2.3 million people. So now, with most of the population being pushed towards the south, and most of, unfortunately, the indiscriminate bombing, nothing is being respected. No health workers, no health facilities, which are not meant to be a target. Hospitals are meant to be a safe space. But unfortunately, in these almost now 3 months, we have lost 4 of our colleagues in Gaza. And when I talk about the most recent thing, we had our staff sheltered in one of the areas in southern Gaza, more than 100 staff and their families. And we had informed the Israeli authorities about the location. That is what we do. In any conflict, we inform all the warring parties about our coordinates to make sure that they do not target healthcare or healthcare workers. But then a shell came in towards the shelter, and unfortunately, one of our staff lost their 5-year-old daughter. So it's talking about a shelter, but our hospitals have been attacked, our ambulances have been hit. So nowhere is safe in Gaza. That's what I can say.
How do you, these are very tragic consequences associated with the job. It's not like any other job. You have a real cost to pay here. How do you deal with this? What is the aftermath of losing a 5-year-old child?
I would say not only me. When I tell you we are a 52-year-old organization, that means over the years we have developed a lot of understanding on duty of care towards our staff and their well-being. And to achieve that, we make sure their psychological well-being is taken care of. We have regular debriefs with the team. We make sure that we have psychologists, counselors for their assistance. And we also rotate our teams. So we make sure that if there is a team on the ground, like our surgeons, our emergency doctors working in the OTs, we try to rotate them so that they have some rest and recuperation to see if they want to come back. So that's one way of achieving it. The other way of achieving it is that, especially Gaza, let me narrow it down to Gaza. In 2019, because Gaza has been under a blockade, not since few weeks, but 16 long years. So that means that our staff there was already working under very difficult circumstances. And there have been many, many escalations in these 16 years, which has touched the lives of our staff. They've lost their family members, they've lost their homes. So we had started something called Help for Helpers. So wherein we would make sure that our staff gets all the necessary psychological first aid plus psychological assistance to manage. But in today's situation, it's survival. That's what we are talking about. We are not talking about even mental health. So my psychologist informed me that we have never witnessed anywhere around the world that children as young as 5 years narrate to our psychologists that they wish to die. They don't want to live to see these bombs falling on them every day. And a child of 5 years, if they tell you this, that's a lost cause of humanity.
Can I ask a personal question?
Sure.
It's unlike other jobs, this one comes with a real cost, and it's not an offhand chance that you or your family will be in trouble. It's a very real chance. What is your incentive to take up this kind of a job?
Let me narrate an incident for you to know why do we do what we do. It was, I think, 10 to 12 years back. We were in Sudan. And usually when our teams leave, we do a debrief with them just to hear their experiences of what were their experiences, what could be done differently as an organization to improve and learn and grow. So there was this pediatric surgeon from Bangalore. And then I had a doctor from Netherlands. And then I've had another nurse from Middle East. So it was Ahmed, it was Chandrika, it was Maike. And I asked Chandrika, I was like, Chandrika, what is that one thing you take away with you? She told me when she came in, she was the only Chandrika. But when she left many Chandrikas behind. I couldn't understand what she was telling me. And then I asked her to explain it to me. So the people of Darfur, as a mark of gratitude and respect, name their child behind the person who helps them deliver the baby. So all these three people, Maika, Ahmed and Chandrika, in their 6 months assignment, were helping mothers to deliver their babies. And when they left, out of gratitude, many of these people would name their child. And as a parent, I'm a mother. As a parent, if you name your child after somebody, this is the best reward that you can have from people who have nothing but are they willing to share their meal with you. So that's I would say the feeling of that you are not abandoned, that there is humanity, there are people who are willing to care for you from a different part of the world. Yeah, I think that gratitude is the best blessing that you receive in this role.
But when you joined, were your family against it, or how did? Let's talk about how you got involved with the organization personally.
By training, I'm a journalist.
Okay.
But very soon I realized that this is something that may not be what I would like to do. So I did pursue psychology, and I pursued anthropology as I went forward. And slowly I started developing interest in international humanitarian work. And I met a Brazilian psychiatrist, and we got on talking, and that is how I got into this organization. And since then, there's no looking back. Was it easy for my parents? I would say, like any other parent, they had their worries. But every time they would see me, they would find me a bit more humble. If you ask me, I can tell you just one thing. 20 years back, I was more arrogant. I was more confident. I felt I knew the world. Today, I believe I don't know anything. I have every day to learn something new from someone, and it can come from anywhere. That humility and gratitude that this work brings in you, I think my family also sees that.
as journalists, we are often asked not to take sides, and it's a bit difficult. If you're a political journalist, you have to talk to politicians, but then you also cannot take a side. But your job is like very interesting in that way. Like it's almost like walking in the rain without a raincoat and not getting wet. It's you can't take sides, and the world doesn't want you to take sides because the world want you as an institution there. That you are an institution that we can rely on, and that involves not taking sides. But on the ground, when you see these things, you might, you are, after all, you're also human. So how do you manage this expectation to not being partial on the ground?
So there was a time when there would be two sides of a conflict or a war. And we are in a context now where there are multiple parties in a conflict. Our role as a medical humanitarian organization is to be proximate to populations and the patients we treat. So when a patient reaches our doorstep, irrespective of what they were outside that, when they enter the hospital, when they enter the clinic, they are just patients. And we treat them as patients. We do have a no weapons policy, irrespective of the fact whatever you wear outside. But once you come and seek assistance, medical assistance from our clinics, our hospitals, we treat you as a patient. When we talk about neutrality, it doesn't mean that we don't talk. We talk to every side, but we make it very clear that the principles that guide us to work are humanity, neutrality, impartiality. What does that mean is that we are there only for the population. We do not care what your political differences are. We are there to treat people because for us, access to healthcare is of most importance and dignity of care is all the more important.
Do you think organizations like yours and Red Cross, all these organizations should be neutral by the very nature of their work? Should they be neutral?
Neutrality is a tool. It is also about how do you understand neutrality in a context. When for us, neutrality is that we are not here for any side. We are here for only the population that is caught in between. And that is what we try to express. When we express neutrality just for our population we serve, not for the sides that are there.
Has the job made you a cynical person in the sense you don't see any, you see the world as a totally lost, immoral wasteland?
Hope is the best medicine.
How do people, young people who want to work for something like this, reach out to you and get to know you?
We have a website, www.msfsouthasia.org or msf.org. You can just Google it and you can find us. And there is more than one way to be part of this movement. We are not an organization. We call ourselves a movement because it's made up of young people like you and me. And there is no distinction. You could be a doctor, but you could be also a nurse. You could be a journalist. You could be a finance person. You could be an HR person. Because we need all of those people to work together to help this ecosystem function. We work in 70 countries around the world. We have more than 65,000 staff. They come from more than 149 nationalities. So all of us come together with the spirit of shared humanity and global solidarity. So some of them work with us. If you're a doctor, you come and work with us. You work alongside with the colleagues in the country of operation, wherever you're working. But you could also, if you're very busy and you do not have your time available, you could think about making a donation towards MSF. Because we are one of those organizations that sustains on, I would say, the trust of our donors, which are more than 7 million people around the world. So more than 85% of our money comes from individual donors who pay 100 rupees, 100 euros, 1,000 euros, $1,000. So what is very important is there is more than one way of being part of this organization.
But still, how to get hired by Doctors Without Borders?
So while you work with Doctors Without Borders, is like all the treatment is free of cost. But the hands that treat those patients, they have to go through a very rigorous recruitment selection process. So when they apply on the website, there is a recruitment team that reaches out to them to do the recruitment process. And once they are recruited, they are part of our pool. And based on their availability, they can be sent anywhere around the world.